It can't be you that takes care of a patient alone. When you see a head resident running around at night, come see all the patients that came in, that's fraudulent. He can't possibly be the intern for that many people. He either has a system he trusts or he's going to lose. And when he's the most ruthless with the people under him, it's when they violate the system, because the people are in the hands of a system. And when someone says, I take care of that patient, I'm her doctor, that's fraudulent. It's, you know, no one points to a Pontiac and said, I made that car. A system makes that car. And even in the pre-Flexner days, no one could take out cataracts, handle porphyria, diabetic acidosis, perforated ulcers, depressions. No one ever did all those as well as they could be done. Of course we want specialization. And if you have a gallbladder problem that's really tough, of course you'll want Cattell to sit up there and do it at the Lay Clinic. He did thousands of them, and he was magnificent. You want that. If someone takes out your mother's cataracts, you want the feeling that he's done hundreds of them, and he does it magnificently with minimal chance of failure. But yet if he's that good and focuses, will he be able to encompass everything? No, he will not. So you want people to be part of a system. You don't want a family practice program where you teach them to be superficial. A system builds automobiles, and it's going to take care of people, and if we don't recognize that simple fact, then there are going to be an awful lot of people that are not going to get cared of. And there will be 100,000 people in the middle of Chicago floating around Cook County getting less than adequate care. It's like Henry Ford saying, I personally am going to make an automobile for everyone in the population. I don't believe in systems and assembly lines. I'd rather have my personal touch on it. He'll make an automobile for 2 or 3 people a year. The other 200 million will have none, and that is the basis for a revolution. And this is the basis for a system. The record has to be. You can write a check in Atlanta on a New York bank. Why? Because there's a system. And it's known throughout. But you get a coronary in Atlanta, and your records are in Chicago, just try to find things out in the first 24 hours. Because even if you called up and they got it out of the record room, the girl in the record room was in the same position I was. What did you want to know, doctor? And there she is. You probably wouldn't be able to get her on the phone, but if you did, you're just wasting your money. She should be able to read off that problem list just like that.